Hi, everyone. I'd like to do a shout out to our sponsor, Baco Diagnostics. Early detection is the single most important factor in improving patient outcomes. The Baco Diagnostics team recognizes how impactful a podiatric physician can be and remains committed to supporting you in your role as the first line of defense in diagnosing conditions of the lower extremity. Thanks to the unwavering support of our clients, Baco Diagnostics has been able to give back to the podiatric community for 16 years by providing podiatric educational resources and advocating for the profession. Baco Diagnostics, helping podiatric physicians keep America on its feet. If you have not yet had the opportunity to utilize Baco Diagnostics services, get started today by sending an email to corporaterelations@bacodx.com. The first 50 podiatry offices who request a starter kit will receive a Dean's Chat mug. Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. Once again, I'm with my co-host, Dr. Joanna Ritchie. Hi, Joe.
Hey, Jeff. How you doing?
I am doing fabulous. I am super excited about our interview today. We've got 3 students representing the Des Moines University College of Podiatric Medicine and Surgery. For our audience, just so you know, we're doing these bonus episodes this fall, and we're going to be introducing students from each of the schools to you, and we'll be discussing all the colleges of podiatric medicine with the hope of showing future students what going to school at the various colleges is like. So I wanted to welcome our guest today from Des Moines University, first from the class of 2026, Emily Maxwell. Welcome, Emily.
Hi, Dr. Jensen. Thank you for having me.
You are so welcome. And from the class of 2027, Haley Cornelison.
Hi, so happy to be here today.
Thank you so much. And also joining us from the class of 2027, Jaquine Egbon. Welcome to Dean's Chat.
Thank you for having me.
Oh, you are so welcome. We usually go with first names, but when we work with the students, we'll still go with Dr. Ritchie and Dr. Jensen. So I'll turn it over to you, Joe.
Well, thank you both, or all 3 of you, not both. We've got 3 fabulous students today for taking time. We know how busy you are as students with your study schedules. We'll start with Emily, if you don't mind just defining for us, what is podiatric medicine?
Yeah. So I'd say that podiatric medicine is the diagnosis, treatment, and prevention of ailments of the lower extremity with a particular focus in the foot and ankle.
Thank you so much.
Very good. And Jaquine, would you mind defining the educational pathway to becoming a podiatrist?
Sure. So usually you go through 4 years of undergrad, and then 4 years of a podiatric medical school, and then 3 years of residency. After that, you have the option of going into practice or doing a fellowship.
Very good. Thank you.
We love to kind of get standard answers for people that are tuning in. Maybe this is the first episode they've ever listened to, so that we kind of set the playing field of what we're talking about today. So we'll shift now a little bit into each of your individual experiences. Maybe Haley, we'll start with you since we only had 2 basic questions to start with. But if you can tell us a little bit about your degree in undergrad, kind of what you were studying and focused on, how you found out about podiatric medicine, and then if you had the opportunity to do any shadowing, kind of what that experience looked like for you.
Yeah, of course. So I did my undergrad at Whitman College. It's a small liberal arts college up in Walla Walla, Washington. Really fun word to say. But while I was there, I played collegiate soccer for 4 years, which was an absolutely great experience. I studied biology and minored in chemistry. I was involved a lot in the biology department, and I also worked with local elementary schools to help tutor kids. And yeah, so ironically, my dad's a podiatrist, but podiatry was never sort of on the forefront of my mind of something like I was going to have as a career growing up. Maybe around my sophomore year of college, I really started to explore different medical specialties because I knew just loving biology and everything, that's something I wanted to do. So I really kind of dabbled in everything like physical therapy, athletic training, pediatrics and stuff. And, one thing I really found that I enjoyed was surgery. And, I think I really wanted to be with the patient from the moment of diagnosis to their actual to their actual treatment and then following them throughout the whole entire process. And, I was having a heart to heart with my dad one day, and he's like, in no way am I, pushing this on you, but I think this would be a great career path. And honestly, I have absolutely no regrets. I have absolutely loved my journey so far through school. So my shadowing experience, I guess you could say I've had lifelong shadowing in terms of living with the podiatrist, but I think that was more of like the outside office stuff I got to see. And something really great is just seeing that great work-life balance. He was still able to coach our soccer games growing up, but still be very involved with his practice and with the field in general. I actually shadowed another doctor at his practice, ironically, but still a great experience just getting to see, day-to-day life and everything. But that's just a little bit about me and how I ended up here.
Fantastic. Thank you so much. All right, Emily, you're the next one in my line on my screen. So go ahead, tell us a little bit about your undergraduate, how you found podiatric medicine, and what the shadowing experience was like if you had that opportunity.
All right. So I did my undergrad at Southern Arkansas University in Magnolia, Arkansas. I did play collegiate softball there for 2 years. My second year season got canceled because of COVID. And then after that point, I kind of just didn't return because I wanted to focus more on the shadowing aspect of things to just kind of ensure that I had a place in medicine. My first initial dip into podiatry was actually probably my senior year of high school. My best friend from home was just kind of talking about the direction that she kind of wanted to go in her life. And she had mentioned podiatry school. And so she had kind of touched on it. And I was like, oh, that sounds kind of cool. But it was one of the instances where I heard her, but I wasn't really listening. So fast forward to my second year of undergrad and playing softball, and I had one of my teammates who severely sprained her ankle, and our athletic trainers were just kind of like, you know what, I think we need to refer you out. And so they referred her out to one of the local podiatrists down in Magnolia, Dr. Austin Reeves, and she came back just absolutely raving about him. And I was like, you know what, I remember my friend talking about this. So I was like, I'm just gonna Google search, and then I called his office, and he was kind enough to let me shadow him. And he's actually working out of Texarkana, Texas, which is not too far from my hometown. So I got lucky enough that he was in Magnolia on Tuesdays and Thursdays. So he let me come in and shadow him there at that clinic. And then while I was on breaks and stuff back home, I got to shadow him in Texarkana. So it was always super fun to go in, and he had this poster on the door that said, "My feet are my foundation." And first day I walked in, I was like, how cliche, like a podiatrist that like just has that poster as soon as you walk in. But it doesn't take long to figure out that your feet lead you everywhere. Problem in your foot is a problem everywhere because you can't go nowhere if your feet hurt. But it was always fun to see people walk in and they had a cure or a diagnosis or at least something to try by the time they walked out. And I was like, this is a field that I could really see myself in and love. I've never met an unhappy podiatrist. They always have this wonderful work-life balance, and they're always people who are encouraging others to learn more about the profession. And the only reason I think it's not as big as an allopathic or an osteopathic school is because people just don't know about it. It's a great field, and it's always just wonderful to be able to see those patients come in and then have something to go from after that.
Yeah, absolutely. We've certainly noticed that, haven't we, Jeff? That, once you start to get a little bit of like, what is this podiatry thing? And then you get a little opportunity, which is where shadowing can be so valuable because you hear about it. You're like, okay, yeah, that kind of sounds cool. And then you move on to the next thing. And then you actually get to see it in practice. And you're like, this is everything that I'm kind of interested in doing, all wrapped up into one little area of a specialty. That sounds pretty fantastic. So thank you for sharing all that. Jaquine, can you give us a little bit of your experience with your undergraduate, how you discovered podiatric medicine and what that shadowing experience looked like, if that was something in your experience?
Sure. So I went to Georgia State University in Atlanta, Georgia. I majored in psychology, so nowhere close to podiatry. But I did not know about podiatry like all throughout my undergrad. It wasn't something that was talked about. It was mostly MDs, and then later on it became the DOs were added to it. And then after I graduated, I took 4 years of four gap years. I worked in a hospital, which was Emory Healthcare in Georgia. And that was actually where I always tell the story of like, it was so random how I found podiatry. I got a random email on a random day about a podiatry fair, which was weird because I had never signed up for like anything podiatry before. I knew about podiatrists, but I thought they were like a specialty like MBDO, and then you specialize in podiatry. So I got a random email. I opened it up, and it was I call it my serious email. So only emails that are like filtered come through. And so I opened it up. I saw a fair. I went for it, and I started asking questions. I was like, oh, that was really cool. And then I went to the fair, did all of that. I got all the prereqs and everything. And then I spoke with my cousin, who is also a physician here. And she was like, oh, yeah, I know about podiatry. And she told me a little bit. And she connected me with an extended family member who is a podiatrist, that I never knew. And so it just started going down the line, and every piece just started coming up podiatry. I was like, okay, this is how it's going to go. But then when I spoke with the person, the extended family member, and they told me about it, they linked me up with some doctors to shadow in Georgia. I shadowed them. I made sure that it was mostly like basically different areas, just because I wanted to see how what each person focuses on, because there are subspecialties in podiatry. And so when I shadowed like different doctors, they all specialized in different things. One was more diabetic patients, one was more so a little bit more so research, but more sports med. And it was so nice like seeing the different like subspecialties. And like Emily said, everybody was pretty happy with their field. I love like seeing them with their patients, and the patients come in with like pain, and then they feel a little better. It may not be 100%, but like there is a plan. And I had shadowed like different physicians, different specialties, but podiatry was the one that stuck out for me. And boom, back I'm here.
And the rest is history, right? And I think you brought up a really good point. You know, oftentimes part of why people don't realize that podiatry is like a separate subspecialty is the lack of awareness that it's actually a separate track. That there is a similar structure in terms of the 4 years of podiatric medical school, and then surgical residency and training is typical that, you know, you see someone operating, writing prescriptions, and you know, doing all of the care for a patient. It just kind of gets assumed that, oh, it's just another specialty within medicine as a whole, which is true, but the pathway is different. And I think that that's a really unique thing or important thing to maybe highlight. So thank you so much for sharing all of that. I'll throw it back to you, Jeff.
I think it's also interesting, and this is universal, whenever we're doing our interviews with students, and this is at our school and other schools, they always talk about the shadowing experience as being that tipping point. They heard about podiatry, but they weren't quite sure about it. I wasn't sure if they wanted to go down that path, and then they go and shadow. And I thought, Emily, something you said was interesting, that you don't shadow podiatrists that don't love their job. Podiatrists have typically really tailored their practice to do the things they like to do. So hence they like it. So, and Haley, not everybody has the opportunity to have their father kind of walk them down the path for a couple decades first. So you're very fortunate. All right, let's shift gears a little bit. I want to talk about APMSA, the American Podiatric Medical Students Association. These are the student association that represents the students in all facets of our profession, and they're the leaders in our schools. And I was wondering if each of you could talk about how you found out about APMSA, and then once you got elected, what your role is with APMSA within the school. Why don't we, Emily, let's start with you.
All right. So I would say that I found out about APMSA just through school in general. They typically have APMSA presentations to kind of introduce what the organization is to us and how we can get involved within it. There are 2 different elections that happen. So my role is a little bit different than their role as APMSA delegates, because I serve as our student body president within SGA. So I get elected a little bit later in the school year. So that means that I'm elected as president-elect, and I get to follow the president for about a year. But within that role, I still get to attend the national conferences and the House of Delegates meetings that we have with APMSA. And my first year as president-elect, I'm not quite a voting member yet, but I do get to see how things unfold. And I do get to give my input to our school's delegation and our team. And I get to help navigate the way that we progress and advocate within the podiatric field. In addition to just attending HOD meetings, I also have advisory council meetings here at the school where we meet with presidents of the other colleges. So like our DO counterparts and our health sciences programs, we all come together with student life where we can organize events school-wide for all of us to participate in. And then I serve as the student representative on the Iowa Podiatric Medical Society board. So I also get the privilege to sit in on their meetings and give them student updates as well as things that are going on within APMSA that maybe they haven't heard about yet. But overall, I went out for the presidential role just because I've always had a passion for leadership. I wouldn't say that there was something specific about it that just intrigued me, but I knew that I wanted to represent our college on a national level and be kind of the go-between students and faculty and even student life to help bring us all together. So yeah, being president of our school has been an honor, a privilege for me, and it's blessed me with a lot of opportunities that I don't get to be, that I'm not blessed in other leadership roles.
Fantastic. That's a great story. And Jaquine, would you share with our audience how you got involved with APMSA and perhaps which committees you're on and how you represent the school?
Sure. So I knew about, I think me and Haley actually, we are in the same class. And so usually during orientation, the seniors would come and talk about APMSA. And that's when they talk about like the different roles and the different pretty much leadership positions that are open in the school. And so when I listened about the APMSA, I actually went online, did more research, and I found that I actually wanted to do this. So I reached out to the class of 2026, which is our seniors delegates, and they pretty much answered all my questions and everything. And we had an election. And so I am the alternate delegate. Haley is the main delegate. And so we both go to the HOD conferences and pretty much represent DMU CPMS. And then we go to the conferences as well and relay all the information back to students here.
Fantastic. Thank you. What was your favorite part of the House of Delegates meeting?
Pretty much, it was scary at first because it was like it was our first year. And everybody seems to know everybody already. And so it was almost like, oh my God, I'm coming in and I don't know anybody, except my delegation. But when I met like other first year students and they felt the same way I did, and it made me feel much better. And I was able to go to like the ACFAS conference and all of that. So that opportunity to meet different physicians in a professional, semi-professional way, and just build those relationships that I would never have otherwise done if I was not a delegate. It's pretty cool.
It's great. Everything's about relationships. There's no doubt about that. So Haley, what's been your experience with APMSA? How did you get involved and what responsibilities do you have?
Yeah, so again, like Jaquine was mentioning, so during our first year orientation, there's kind of an overview of different leadership involvement on campus. And one of those things is a very well put together presentation on APMSA. And it was a really nice video played, really nice presentation. And I was like, wow, I want to do that. I want to be involved. I want to like make changes, that benefit like me and my classmates' future. So again, the upper year delegates were like hosting Q&As and stuff and everything. And I was like, do you know what? This just sounds like something I'm really passionate about. So I ran and fortunate to be, representing my classmates. And as within APMSA, I am involved in some other things. I am a member of the legislative committee. So we kind of go through different legislation that's pertinent to the podiatric medical field and kind of go through like which ones do we want to support through APMSA and things like that, but also how can students get involved in legislative efforts. I think it's really important that we are the future of podiatry and that we are able to help shape the future that we're going to be working in. And I'm also the student liaison to ABFAS, which is the American Board of Foot and Ankle Surgeons. So I work with them and connect them to students and just am a voice for them of the student perspective.
That's great. There's so much to be said for advocacy, and no matter what profession you're in, advocacy is so important. And APMA plays such a critical role, and it's just great to see it trickle down all the way down to the schools and the students. So that's fabulous. Thank you so much.
Yeah, and even to that point of relationships, Jeff, right? Like you're building networks and opportunities to engage with a variety of different people and organizations, and I just think that's really fantastic. So kudos to all three of you for all the work, because it's not a simple thing, as you all could attest to. We're going to shift into curriculum and managing all of these different asks of your time, your energy, and your attention. We'll break it all down into the first year, the second year, and then we'll kind of group third and fourth year together, if that's okay. So Haley, if you don't mind, maybe talking a little bit about what that first year curriculum looks like at Des Moines University.
Yeah, of course. So something unique about Des Moines University is that there's a lot of integrated education. So all of the students in the College of Podiatric Medicine and Surgery take a majority of their classes with the students in the osteopathic medical college. So we are taking anatomy. It's called our foundational science course. So it's kind of like biochemistry, immunology, microbiology, all kind of clumped into a year-long class. We take a clinical medicine class, and we also take a principles and practices of podiatric medicine course. And of course, we take that just as our CPMS group. But yeah, so then how it works is that we are on a block schedule. So we have 4 blocks in the entire year. And pretty much you're having exams every 2 weeks. So you will sit down every 2 weeks and you will take all of your exams for that clinical medicine course, anatomy, and foundational sciences all during that one time. And then you kind of just do that throughout the year. So it's kind of nice. You have like an off weekend where, you can just catch up on studying, catch up on sleep, some other stuff. And then you have that following week where you're really kind of putting your head down and you're really just trying to do well on your exams. But yeah, lots of labs, lots of hands-on work. Our podiatry faculty really try to help engage us within that first year, just because we aren't taking so many podiatry-based classes. So that's really where lots of clubs come in. There's a lot of podiatry-based clubs that will do fun like ankle taping events or like sawbones workshops. So even though we're not doing as much academically with podiatry, there's still a lot of engagement to make sure that, we still have a lot to look forward to going forward.
That's wonderful. Thank you. And I love that you highlighted, because some of the other questions we love to ask is, what are the opportunities for interdisciplinary experiences? And so you had said you guys are integrated with the DO program there. In terms of class size, do you have a relatively small podiatry class that then is part of the larger? Like, what does that kind of look like? General numbers, it doesn't have to be exact, but.
So our class size, I think the cap for all of the podiatry years is 60 students. And then the DO class is typically around 230. So they're a bigger group. So first year, you have a chance definitely to get to know more people. You also get to kind of share with your DO classmates, what is podiatry, and get to educate them on the field and everything, which is really fun. So first year, you kind of get that larger experience. So if you come from like a bigger undergrad or you like the bigger classroom experience, we're all in one lecture hall together. You still get that experience. And then what Jaquine's going to, touch up on is that, our second year, we're very much just with our DPM fellow students. So you kind of get that big group experience your first year, and then you kind of get to narrow down and get to know some of your podiatry classmates more in your second year.
That's fantastic. Thank you so much. And thanks for my segue. So Jaquine, do you mind giving us kind of the outline for what the second year curriculum looks like?
Sounds good. So second year, I say it ramps up a little bit, just because now you are with your DPM counterparts. We do take, we have something called clinical systems, and it covers basically like cardiopulm, GI, endocrine. So it covers most of those broad topics, but it links it up with podiatry. So the body is a system. It's not just one part, just one individual different parts. Everything comes together. And so that's what we do here. It's clinical system like cardiac diseases and how would it affect the lower limb. And it just ends up tying down to podiatry. And we also take pharmacology classes, medications, all of that as well, because again, we are going to be prescribing meds and we need to know what happens on interactions and all that. We have, so fall semester is mostly academics. It's the springtime that we'll be doing lower limb and going into the lab and actually being able to get more hands-on, which is pretty good because then you're able to know like that foundation and that root before going in and putting it into practice in lab. We also take a lower extremity dermatology class, which is common dermatological correlations and disorders that you'll be seeing as a podiatrist. But pretty much everything is still linked, even though it's like broader topic, is still linked into podiatry. And then in the springtime, we will have our lower limb class and practical, as well as biomechanics and other podiatry related fields. So
Excellent. Thank you so much. All right, Emily, you get the workhorse of 2 different curriculums. So we'll start with 3rd year and then transition into what kind of 4th year looks like.
All right. So 3rd year begins with the second half of what's called summer clinic. At DMU, you're divided up into summer clinic 1 and 2. So there's 2 groups and you kind of rotate 4 weeks on, 4 weeks off, and then the other group is on. So whenever you start out, you're taking basic surgical and medical skills. So it teaches you things like how to scrub in, suturing, instrumentation. So you go through that, and then we go through a trauma course. And then our last, I'd say, official didactic course is our like healthcare systems jurisprudence course. And that's kind of what we end on. And then we're transitioned into larger groups for clinic and more like the clinic full-time thing with a base of evidence-based medicine curriculum underneath it to just kind of reinforce the things that we've already learned. And then we go through, we have a couple different clinic rotations. We all obviously get divided up into where we're going. So we have 3 different rotations at just the DMU clinic with our own faculty. We have a non-podiatric medicine rotation. That's either in internal medicine at any of the surrounding hospitals or a vascular surgery rotation. We have a rotation that's a month long that we do at the local VA here. And then we have a community rotation also built into 3rd year where we can stay in the state of Iowa or we can go out of state. So as we transition through all of those, is whenever we're starting to get our clerkship applications and stuff going for 4th year. And that is like a whole research process, reaching out, seeing that networking opportunity that you've put in. And then as we go into 4th year, DMU does what's called a core rotation, which is one place for 3 months versus the alternative, just rotating specific places 1 month at a time. We do have the opportunity to be at one place for an entire 3 months. And I love that about DMU because it's a longer opportunity for them to just kind of watch you grow in your knowledge and your skills. That rotation can be done at any of the 3-month periods throughout the year. But our first 4th year rotation just start in May, and then it goes until the following May. At the end of that, or some point in the middle, it can really be whenever you choose it, between clerkships, there's also a private practice rotation to fill, a medicine rotation, and then you get a vacation month.
Fantastic. Thank you so much.
I'd like to ask Emily one other question. Can you talk about boards part 1 preparation at the end of your 2nd year going into your 3rd year?
Absolutely. So thankfully, DMU does a fantastic job through 1st year and 2nd year curriculum preparing us for boards. But in addition to that, we do get access to board vitals, and that gets utilized by everyone pretty much. There's also a APMSA Part 1 prep on our D2L website that you kind of go into, and it's broken up into folders that are comprised of like PowerPoint slides, Panopto videos, and some handouts made from former students that were like, hey, make sure you hit these topics. And it's a good refresher to go back to if you don't feel like you have the time dedication to put into like physiology or embryology. There's at least one document you can fall back on that has a couple high points that are like, hey, make sure you know this. A difference between DMU and other schools is because we do have that summer clinic divided up into 1 and 2, you don't have a set time off just for board study, but everyone does board study within that clinic time.
That's fantastic. It's always best when your curriculum prepares you so that you can pass boards, and then you just go back and
Yes.
review it before the test.
And
Thank you.
they've looked at whether you give somebody, X amount of time off to study, whether that really makes a big impact, and it doesn't. And sometimes it helps, sometimes it doesn't, because people take vacation, or it's just so hard to stratify some of those things. So sorry, I didn't mean to jump in, Jeff.
No, it's great. Well, we're going to move on to our one of our most fun sections of these interviews, and it's professor shoutouts. So I'd like to give each of you an opportunity to shout out to one of your professors that's made an impact on your educational experience so far. Jaquine, can we start with you?
Sure. I'm like, oh, now my brain is like, oh my God. Does it have to be a DPM professor, or can it be any of our professors?
No, basic science, DPMs, MDs.
Well, I would like to, oh my goodness. I would like to shout out Dr. Fong. Anybody who knows Dr. Fong knows why we're shouting Dr. Fong out. He is really sweet. You could tell he's really like passionate about taking care of his students and making sure that we excel. And he's very funny. So I'm shouting out Dr. Fong, and then also Dr. Spocker. Again, anybody who knows Dr. Spocker also knows why I'm shouting these two professors out.
What do they teach?
Dr. Fong teaches us mostly pathology, and then Dr. Spocker is anatomy.
So they sound like they're fan favorites of the students for sure. All right, thank you, Jaquine. Haley, professor shoutouts. Who's made a tremendous impact on your career, and besides your father?
We just have so many great faculty at DMU that it's so hard to pick. But I think, one that comes to mind is Dr. Dykes. She is one of our podiatry faculty, but, I think just having her, on campus, like she's such like a role model, especially as a woman in the field, and seeing how involved she is, and, like having a family and everything, like, it's just really great to see, woman in the field just absolutely killing it. And, she's a great lecturer. We always love having her. So I just love to give her a shout out just because I really admire her.
We can give her, Ashley and her husband, Jeff, a shout out. They run a podcast called the Pod Patrol.
Mm-hmm.
So all of our listeners should check out the Pod Patrol podcast also. Thank you, Haley. Emily, who's your professor shout out?
I'm going to give a shout out to Dr. Matz. He runs the anatomy department here. He is someone that you follow through first and second year, but you can just tell through what he does that he's super passionate about his work. And through things that are tough to grasp, brachial plexus, cranial nerves, some of the lumbar sacral plexus things in the lower limb, he makes up crazy stories, and it just sticks after that. Like I don't know how he does it, but he's hilarious, and he loves his job, and he loves teaching, and he loves those student moments where he can just see the light bulb go off in your head, and you can tell that just makes him proud. He is someone that I strive to be more like every single day.
That's fantastic. Joe, whenever we talk about professor shoutouts, it leads into the next question: why DMU? I think we're getting a taste of it here. We all know that early detection is the most important determination in improving patient outcomes. Bako Diagnostics remains committed to supporting you in your role as the first line of defense in diagnosing lower extremity pathologies. Bako Diagnostics, helping podiatric physicians keep America on its feet. We always like to give a good shout out to Bako. They take such good care of all the colleges doing biopsy labs. And then even when you're out of school, they'll help you out as a resident and in practice. So Jaquine, let's start with you again. Why did you ultimately choose Des Moines University College of Podiatric Medicine and Surgery?
So one thing that stuck with me with DMU was the fact of we taking our classes with the DO students. I worked in a hospital, and I worked with MDs, DOs, DPMs that I did not know were DPMs, but I knew they were podiatrists. And it made me realize they were all part of the care team. Everybody was important. Everybody had different experiences. And just having that opportunity here, when I found out that it is integrated first year, because again, these are going to be your referral base. These are going to be your colleagues. These are the people that, if there's any case that you don't understand, you have friends that are like, oh, this person knows this field, maybe they can direct me. And it's also so great because a lot of the students here, they did not know about DPM programs or podiatry before they came to DMU. And just seeing, we have labs together, we take classes together, it builds on that respect because they know like, oh, I went to school with DPMs. They know what they're doing. They know this is how it is. So that respect is being built from the grassroots, which is our first year. And so that was something that was really important to me. And that's one of the main reasons I chose DMU.
Fantastic. Emily, why DMU?
So I think it's really easy to say why DMU and then point to the board pass rates and the residency placement rates, and to be at a place that really just feels like your future is guaranteed. But it's also just the community that DMU builds around itself. Everyone here is close. My class specifically, I know that I can say that we all have put forth an effort to get to know each other and help each other out. And no matter what year you are or what class you're in, there's always people here to just kind of reach out and be like, if you don't got it, I'll help you. If you need someone, it's not even like you scratch my back, I'll scratch yours. It's just people, it's a community that's there without asking for it. And it's a place that truly feels like home.
Fantastic. And Haley, why DMU?
Yeah, and my answer in many ways is very similar to Emily's. And I think, what I like to say is that it's definitely the people there. I think it's the faculty. It's so evident that the faculty want you to succeed. They're, not just the DPM faculty, but, all of our other faculty that teach our anatomy and our foundational sciences. It is so evident that they just want what's best for you, and their doors are always open. If no one's coming to go talk to them, they're like, where are you guys at? We love to chat with you. We want to help you. We want to be here for you. And to me, I just wanted to be somewhere where I knew I was going to be supported. And since I've been at DMU, I have definitely felt that. And again, like Emily said too, the students, we have a big little program at DMU, and my currently now, I guess, third year big, she's done absolutely so much for me just, because she knows it's hard, and she's wanted to be here for me and support me. And, we get coffee, and I just kind of get the time to just kind of like rant a little bit sometimes, because sometimes you just need that, and you need people to listen and support you. And, like people in Emily's class, they pass down board resources, they pass down class resources. So it's just a community where I feel very supported, and also the institution as a whole just really cares about students. We have a fantastic wellness center with free exercise classes. I love to go cycling classes Tuesdays and Thursdays. We have a counseling center that I believe has no quota on how many times you can go. There's a lot of wellness events for students. So definitely just a place where I feel supported just no matter what.
Fantastic. Joe?
It's like they're setting us up for these beautiful segues, because my next question was going to be about every university has their own special activities or things that they get involved in the community. Tell us a little bit about some of the extracurricular things that you guys are involved, either interdisciplinary or specific to podiatry. We'll start with Jaquine.
So I'm actually very, very involved. It's I think Haley's laughing because she knows. So I'm very involved in extracurricular activities at DMU. I am on the board of quite a few, like SNAPMA, which is SNPMA, which is the Student National Podiatric Medical Association. I'm on for PMA, which is also Podiatric Medicine Advocacy. I'm on so clubs here, it's not just like, oh, it's DOs, PAs, DPMs, everybody's free to join any of the clubs. So I'm also in some of like the DO clubs as well. And it's just because I like getting involved. I was involved in undergrad as well. So I came here and they said, oh no, it's wonderful. We want you to get involved. And so I joined most of the organizations here. I'm on the board for quite a few, and it's so nice, almost like having an impact. You see like the new freshmen coming in, and they're like, oh, what is this about? And what is this about? And you're like, oh, I know this. This is what it is. You direct them to it, and you see kind of like that, kind of like helping them grow a little bit, just the same way like my seniors did when I was starting off as an FYL. We have something called FYL, which is like first year liaisons. And this is for first year where you can come into the board and see how it runs. And then they can pass over the reins to you when it's time for them to go into third year. And so just being like that person that's going to do it for the next year and on, it's really nice to see. So.
All right, Emily, you're up next. What are some of your favorite activities that you guys do?
So not school-wide, some of my favorite podiatric activities that we can organize as a college. We do an event called Foot in the Door, which is just an event with all the colleges where we have an organization at the beginning of the school year where the first years get the opportunity to meet third years and then the faculty. Our second year class does a really good job too of organizing like a volleyball game or something for to invite their littles as soon as the first years get on campus so that they can really encourage each other as well and just meet face to face for the first time most of the time. And then also every year following Christmas, we have a college-wide holiday party, which is super fun because we also host an ugly sweater contest at
Nice.
that event. So it's really fun to see what people can come up with because sometimes they're pretty creative. And then school-wide, it's really fun to do things with the DOs too. That we do have things going on just like in the cafeteria area sometimes in conjunction with student life. There's and the wellness center, like Wellness Wednesdays, they have things like pumpkin decorating, or they just like pass out goodies every now and then, just be like, hey, just remember to obviously study and you want to do well in school, but also prioritize yourself.
Thank you. All right, Haley, you get to be the last. What activities, or also they don't even have to be just campus. I'll throw in for you. Tell us about Des Moines as a city, maybe something outside of campus that you also like to do. Make it fun.
Yeah, I guess my answer kind of does tie into both. DMU does a great job of like getting involved with the community. So community service, we have a volunteer service award where if you do 50 plus hours of community service from the beginning of the year till May, you get recognized at a little ceremony at the end of the year, but tons of ways to get involved. Like last year, a group of friends and we volunteered at the Des Moines Marathon and, got to like cheer on people running by and stuff like that. And, me and my friends, we like to go to this place downtown where it's a organization that pretty much provides housing for families who are in between housing, and we go and play with the family's kids so they can have some time. So just love how I've been able to get involved in the Des Moines community. I remember telling a lot of people I was moving to Iowa because I'm originally from the West Coast, and people are like, what's there to do in Iowa? And let me tell you, there's plenty to do in Iowa. We got tons of minor league sports teams. We got the Iowa Cubs, Iowa Wild for hockey. There's a botanical garden. Jaquine and I have gone axe throwing before. So there's just a lot here, and it's a relatively safe area. And yeah, I've just really enjoyed getting to know the people in the community just because, when I'm in Emily's position next year, I'm going to be working with the people in the community, in clinic and stuff like that. So it's cool that I've been able to engage with them very early on.
That's lovely. Thank you so much.
That is great. We've got a little extra time, so I had one more question I'd like to each ask of you. Can you tell us the one thing you do to recharge your battery to kind of relieve stress after you take exams and you get that weekend, right, between exams? What do you do to kind of kick back and recharge your battery? Let's start with Emily.
Okay. So I will say that I have a dog. So every day, at least 30 minutes a day to recharge from that, I walk my dog. She loves it. But if I'm just going to sit down for a while, I love to read.
Fantastic.
Yes, I love to read.
Fiction, nonfiction?
Fiction. It's fantasy.
Very good. Well, thank you. Jaquine, what do you do when to relieve the stress of a medical school curriculum?
So usually after exams, after hanging out with my friends, of course, after just to go lunch or do something just away from school. I do axe throwing like Haley said. So there's somewhere called Ironside Axe Throwing, and I would just go there by myself. I would throw axes, and it just feels wonderful.
Right
It
on.
makes me feel so calm. It's like you take all the pressure and the stress. And then when I come back home, usually in the evening time, I would sit down and watch my shows. I'm very into international dramas, like Korean dramas, Chinese dramas, Indian, African, international dramas in general. So I would put on my shows and just relax in my house and just peace. So
I think that's fantastic. So we could get some axe throwing competitions going on between the colleges.
oh yeah, that would be awesome.
It would be fun. Yeah.
Okay. Haley, what do you do to recharge your battery?
So again, being a collegiate athlete, like working out is definitely my sort of like stress reliever, especially like right after an exam. I usually like am pretty tired, but like I find that I'm still pretty high on adrenaline. So I just like love to go in the gym, run it out, lift it out. I also just think it's a very mindful activity for me because it's time where I'm like listening to music. I'm not looking at a screen and it's just time for myself. And I really enjoy it. It's a great way to kind of let out any extra stress or anything. So that's something I really enjoy to do.
That's fantastic. You know, Joe, I think with leaders like Jaquine and Emily and Haley, I think our profession's in good hands going forward.
I agree. I'm so excited to watch each of their careers just continue to take off, and who knows where their networks are going to take them. The future is bright.
Absolutely. And thank you for joining us today. Joe and I are going to send each of you a Dean's Chat cup. Haley, you had mentioned needing some caffeine once in a while. This will take care of it.
It's a very large cup.
So excited.
So student sized.
And so we thank all three of you for joining us. And thank you for all you do for not only the Des Moines University College of Podiatric Medicine and Surgery, but also for the profession as a whole. Thank you so much.
Yeah, thank you for having us. Great talking with you
Thank
today.
you.
You're welcome. And until our next episode, everybody, cheers.